Thanks. In the lead, civil society organisation Treatment Action campaign staged protests outside the offices of Gauteng Premier David Makhura. They want the provincial government to urgently address problems in the Gauteng healthcare system. The organisation is also calling for the reopening of the Charlotte Maxeke Hospital, which has remained out of series since April following that fire that gutted parts of the building. For more on this, we're joined now by Treatment Action Campaign's General Secretary Anele Yawa. Anele, very good morning to you. Thank you so much for your time. You've expressed a lot of concerns when it comes to the healthcare system in Gauteng. Of course, staging, going as far as ensuring that your voices are heard with a protest outside Gauteng Premier David Makhura's offices. Tell us more about what prompted you to move to this extent.
Good morning to you, Mpho, Buse, and the viewers at home. And thank you for having us this morning. The reason for TAC to take this decision is because we have since realized that the politicians and the government officials have a total disrespect and disregard of the Constitution and the rule of law of South Africa. The reason being that all these people knows what are the constitutional rights of the people of South Africa, and they don't act upon them. You go to our clinics, the state of our clinics, the state of our hospitals is a mess. We don't have enough nurses. Many nurses and doctors and some healthcare workers have died because of the COVID-19. Those posts are still vacant, and you go on the ground, you look at people because of COVID-19 are forced now to stand in queues outside those clinics. They are exposed to all conditions of work. And we don't see the government officials and the politicians coming to the rescue of our people in trying to fix what is the problem on the ground. You will remember that there was the Life Estimate inquiry, which gave a mandate to the Premier of Gauteng to say within 12 months, the Premier must erect a monument bearing the names of all those people who died in Marikana. Let's check now how many months after that 12 months. What does that mean about the Premier as well as the officials within the government with regards to the respect of the rule of the law? So this is not only a problem in Gauteng, it's a problem across the country. You will remember even in Eastern Cape, the public protector gave 60 days to the Eastern Cape government to act on those recommendations. That 60 days is coming to an end. So the problem we face in Gauteng is a problem that is happening across the country, where you find out that our government does not have money to provide quality healthcare services to the people, but we see them having money to steal and loot. You know what the former minister, Gauteng did with the digital vibes issue. You know the scandal around the former MEC Anele Yawa. We know how did Brian Songwa look at billions and billions of rands from the public purse of the Department of Health in Gauteng. If we can put together all these monies, for sure, we were going to be saying in Gauteng we have enough doctors, enough nurses, and these doctors and these nurses, their working conditions are reasonable. We were going to say we've got new clinics that have been built and hospitals that have been renovated so that we can be able to provide quality healthcare services. But because of corruption and looting, we're finding ourselves as the people of South Africa being denied access to quality health services. So we felt as TAC to say we want answers from the Premier of Gauteng and the MEC of Gauteng, because we are tired of submitting memorandums where our memorandums will be taken and they will say we will respond to you after 7 days. After 7 days, the only response you get is the lame response. We want now to go with the Premier, we want to go with the MEC on the ground to those clinics and say, you're saying the services are good, let's go to this clinic. Let's not announce when we go to this clinic. Let's have surprise visits so that what you say in your written report can be compared to what is happening on the ground. So that's where we are at now. But also in that process, we want to engage the government and the politicians to say, how about you politicians also, you stop using private healthcare system, you start using public healthcare system so that you can see what the majority of our people are going through on a daily basis. so that you as the decision makers, you can see the urgency of taking decisions that will improve the quality of healthcare services for the people of our country. So that's why we decided to sleep outside the offices of the Premier until we meet with the Premier, until we meet with the MEC, which that happened on Friday, even though we didn't meet with the Premier and the MEC, but we met with senior officials from their offices.
And in that meeting, I know that there were matters that were seriously urgent that you wanted to be addressed, and one of those is the full reopening of the Charlotte Maxeke Hospital. Of course, we know that the hospital has a lot of services that are desperately needed by patients with chronic illnesses who really need access to that hospital, and are then further burdening the shaky hospital system in Gauteng by going to the Chris Hani Baragwanath Hospital, which is really, looking at COVID-19 and the many protocols that need to be adhered to, and overcrowding being a serious problem. Let's talk about how your proposal for the full reopening of Charlotte Maxeke was received and what it means in terms of a way forward.
So in that meeting, as much as decisions were taken about what needs to happen, but we made a special proposal specifically to the HOD of Gauteng, Dr. Sibongile Zungu, to say, despite the decisions that we have taken about the entire state of healthcare service of Gauteng, we've got a special request specifically to her as the HOD to make sure that the issue of Charlotte Maxeke is treated as a priority. What does it mean? It means as much as there are these processes that we have agreed upon them, but there must be a special attention, the HOD, which needs to pay with regards to the issue of Charlotte Maxeke, because we are aware that as much as the hospital is functional, but there are issues of certificates, issues of compliance that are not yet adhered to, and other issues that we think needs to be addressed so that the hospital can be fully operational, so that the hospital can be compliant, and make sure that moving forward there are no other hazards that will put the lives of the people at risk. But with regards to the entire issue, in that meeting, we agreed to say there will be 2 officials from the office of the Premier. There will be 2 officials from the office of the MEC, the National Chairperson of Treatment Action Campaign, the Deputy Chairperson of Treatment Action Campaign in Gauteng, 2 leaders from the Gauteng pediatric sector will form a team of 8 people. This team of 8 people is given 6 weeks. This team of 8 people is going to meet us from tomorrow. They are given 6 weeks to visit all clinics, to visit all hospitals of Gauteng, where we will be able to identify problems. After identifying problems in each facility, we will sit around the table, come up with possible solutions. Then after that, we will invite the MEC and the Premier and say, based on the monitoring we did on the ground, both as TAC, civil society and government, these are our findings. Out of these findings, these are the possible proposals that we are making. What you are saying as TAC to our government is to say, as much as we are quick to identify problems, but also we are offering our services to say we are quick to identify problems, but also we are able to sponsor some solutions on how to address these problems, but also work together with you government.
You speak about this venture and the team. And just going back to Charlotte Maxeke, we have heard that it may take around 2 years for the hospital to be fully operational. And in terms of taking in patients, they've moved from 380 or so as opposed to 2,300 per day when it comes to treatment and being fully operational. In your recommendations, do you have any ideas on how this process can be fast-tracked?
In our view, if the reason for the process to be delayed is around financial constraints, then it means then the government of Gauteng must sit around the table to identify as to say which bidder they can be able to rob in order to pay Paul for the facility to be fully functional. If it means that we, as TAC and other progressive forces who are working within the public healthcare sector, we must work together with the Gauteng government to go to Treasury and request for a special funding in order for Charlotte Maxeke to be treated as a priority. Let it be. But what we do not want from our government is to hide behind the non-availability of funding when we all know that the money is there when they want to loot it. So what we are saying to them, let's go to that kit that you normally use when you want to loot. Let's empty that kit to ensure that everything that has to do with Charlotte Maxeke, we speed it up. So that's why we are saying HOD, go to Charlotte Maxeke, do a proper analysis, identify whether the recommendations that are tabled before your office are realistic or not. But at the end, what we want to see happening, we want to see the facility being opened. We want to see the facility fully functional. So if it means that we need to sit around the table and take decisions that will ensure that such processes, we speed them up in order for the facility to be opened, let it be. That's why we are saying HOD, use powers vested in you as the Chief Accounting Officer of the Health Department.
One of the other aspects that you tabled as a matter of urgency is the availability of contraceptives. We learnt of the shortages, and the shortages could have dire consequences for a lot of people who desperately need access to those contraceptives. What do you think some of those challenges could be in accessing the contraceptives, and the reasons why, to your understanding, the contraceptives were not available?
So one of the challenges this has with regards to access to our lives is to say when women goes to our facilities, they are not given a choice. One has a choice to decide whether you want injectables or you want tablets. So if what is available in the facility is injectables, it means that person will not be given a right to choose, which we feel it's wrong. And also they claim that the reason that there is a shortage with regards to contraceptives is with regards to API, which is active pharmaceutical ingredient that is being used as part of the ingredients to make these contraceptives. So we, at the present moment, what we know is that there is a Gauteng Health Department which works with the National Department. We don't know whether the Gauteng Department did reach out to the National Department to find out whether the National Department does have a buffer stock of the contraceptives or not. So what we are saying now, the problems of Gauteng cannot be treated solemnly as the problems of Gauteng Department, yet they affect the people on the ground. Let us know what are the problems. We are a civil society. Your problem is our problem as well, Department of Health. So if it means that the problems of Gauteng as the civil society, we need to escalate them to the national level or National Department of Health. Let us know about those problems. But what we do not want is a situation where officials are giving politicians wrong information, and after that, politicians come to us with confidence without verifying the information they got from the officials. Let's put the issues on the table. Let's discuss together. Let's reason together in order for us to be able to find solutions with regards to the access to healthcare services of people of Gauteng and people of South Africa in general. And this is what, at the present moment, we are not getting from our government officials and some of the politicians. That's why we have decided to say, instead of arguing in boardrooms, let's go down in each and every clinic. Let's go down in each and every hospital in Gauteng. Let's identify problems. Then after identifying problems, we will be able to come up with collective solutions.
And very lastly, Anele, which are the top hospitals that you will be going to?
Some of the top hospitals that we'll be going to, there are a lot of hospitals in Gauteng in each of the districts. You mentioned Telemogorana, Steve Biko, Charlotte Maxeke, Helen Josephs. You name them all. So we will go to all of these hospitals because this is where many of the people, when they are referred from our primary healthcare facilities, end up going to. But in that process, we will be paying attention also in clinics. And one of the things that we are looking at when we go in these clinics and in these hospitals is the issue of the health governance structures. clinic committees and hospital boards. These structures are supposed to be the mouthpiece of the communities, but we don't see these structures being functional in our clinics and in our hospitals. So one of the things that we are demanding is TAC. If in this particular clinic you are saying to us there is a clinic committee, who else that is needed to be part of this clinic committee? Because what you cannot afford is a situation where we've got shadow clinic committees and shadow hospital boards that are an extension to government, or structures that will be used as a wall between the community and the services. So if it means that we need to call for these clinic committees and these hospital boards to be dissolved and be re-established, that process will be informed by the monitoring we will be doing with the government on the ground.
Very well. Thank you so much for your time. Treatment Action Campaign's General Secretary Anele Yawa talking about the commitment to clean up, clean house and ensure that the collapsing hospitals in Gauteng, that is averted, especially now during COVID-19.